Many thanks for staying with us here on News Desk on Joy News Multi TV. Let's now go to Odorkor Official Town, where the family and friends of a 41-year-old are actually trying as much as possible to come to terms with the decision of that gentleman to take his life. The lifeless body of the man was found this morning around the area. Let's go to the phone lines now and speak to my colleague Matilda from Megan, who is live on the ground and joins us now with some more. So, Matilda, quite a sad story. Tell us much more about this situation there.
Yes, just 41-year-old Ashom, a mason and a father of four. He was found dead in his room this morning at dawn by his 9-year-old son. They don't know what exactly may have triggered him to commit suicide. But according to the information I'm getting from his family and friends, is that this is the second time. He tried it somewhere last year, but he was caught and he was bitten and advised not to do that. But this time around, the young man succeeded in taking his own life, and the wife, the family here, everybody is grieving because he is such a hard-working young man who he didn't really have financial issues where they think he was troubled and all that. So they are still in a state of shock, trying to get answers to exactly what may have triggered him to take his own life.
Quite surprising there, and I don't know, but do we have the police around, and what have they been saying so far?
Yes, the police just came around. They're saying they're going to launch an investigation into it. So I'm yet to speak with them because they are still preparing to take the body out of his room. According to his family, they've been trying to get the police and drawn, but thankfully the police came in about 10 minutes ago, and they are preparing to take the body out of the area anytime soon.
Okay, Matilda, many thanks for your time on News Desk this morning. That was my colleague Matilda from Megan reporting live from Odorkor Official Town, and the news is that the 41-year-old man there has actually committed suicide. It's unclear what his reasons are, but we are told that the police is at the scene and is handling the situation. I'll bring you a lot more on this story in subsequent bulletins, but now we can do some more stories. And 8 people have been confirmed dead in the Bonohafo region following an outbreak of pneumococcal meningitis. About 30 people are also said to have been hospitalized after they were infected with the deadly disease. We will be bringing you a lot more on this particular story shortly. But let's still stay with the health sector, and the Director General of the Ghana Health Service, Dr. Ebenezer Piadenshaw, is asking medical staff of the Ridge Hospital to remain calm as the service examines their petition regarding the appointment of a new medical director for the facility. Some senior staff have rejected the appointment of Thomas Anaba on the basis that the selection process wasn't followed through, and they have indicated they will not cooperate with him. Dr. Piadenshaw spoke with Joy News after a meeting with the Ghana Health Service Council on worker agitations at both the Ridge and Kolebu teaching hospitals.
Eaten by the Ghana Health Service follows the current impasse between staff and management at the 2 major health facilities here in Accra. Some senior staff of Kolebu are demanding the removal of their chief executive, Dr. Gilbert Buckle, for what they say is poor performance. They also petitioned the Health Ministry over the matter. The Ridge Hospital staff also petitioned the Ghana Health Service Council to review the appointment of the new medical director, Dr. Thomas Anaba. The aggrieved staff, who have posted notice of resistance at Vantage Post of the hospital, are citing breach in the selection process. Director General of the Ghana Health Service, who has been in meetings with the council to address the matter, says a committee will be set up to look into the matter.
Yes, we've seen the letter. I've just holding it in my hand here, and it's addressed to the council chair. So we're going to give to the council chair. He will likely to constitute a team to look at the petition and then meet the team. But meanwhile, we expect them to continue doing their normal work because the processes have been, the process that they've gone through, the usual process that normally is taken anytime somebody is supposed to be appointed.
Yes. I know you haven't gone through the details of the report, but I'm sure you may have cited some of the reasons that they were raising as from the hospital?
Oh, the reason is, one I've just seen is that there's somebody who's been working in the hospital for long, and then the opinion is that that person should be the one. Actually, that's the one I'm holding. The person wrote that he thought that he should be the person to be the leader and not somebody who has come from elsewhere. But it's an interview, so we're just going to look, which is open, and it's raising some issues concerning the procedure of the interview. So now we have to get a team to look at it and see the concerns that have been raised, whether they are factual or maybe just perceived. Certainly, anytime there's any issue, we expect staff to communicate to us just like they've done. And sometimes they could even have added somebody to come and then maybe brief us. But we don't expect them to go on riot or maybe display certain things, because that's not the way of the civil service. Exactly, it's not the way of the civil service or the public service. So I think we want to assure them that we'll take care of the petitions and then work on it. So we'll give it to the council chairman, and then he will then probably constitute the team to look at it.
Meanwhile, Joy News has learned that the senior staff of the Ridge Hospital have also petitioned the president over the matter.
Let's now go to our earlier story where 8 people have been confirmed dead in the Bono region following an outbreak of pneumococcal meningitis. Now, we are told that about 30 people are also said to have been hospitalized after they were infected with the deadly disease. But let's try and get an idea of really what this disease is and what could be the trigger to get it to such devastating effects. But let's now go to the phone lines and speak to Dr. Bedu Sakode, I beg your pardon. He's the head of disease and surveillance at the Ghana Health Service. He's joining us over the phone lines now with some more on this particular situation. Doc, good morning. Many thanks for your time on News Desk.
Good morning. Hello, good morning.
Yes, thank you very much for joining us. Now, a disease such as pneumococcal meningitis, well, for most of us, we were just used to the cerebrospinal meningitis. I mean, what disease is this, and what really could cause such a disease in the first place?
Yes, thank you so much, and Happy New Year to all your cherished listeners. Point of correction, you mentioned that I'm the head of disease surveillance. Indeed, it's one of the departments in my division, and I've moved on, Director of Public Health, and somebody else is in charge of disease surveillance.
Right.
You give you the details, and you get in touch of such people.
Sure. Thank you very much, sir.
Yes, and the pneumococcal meningitis that you mentioned, indeed, meningitis is inflammation of the lining of the brain, what you call the meninges, and a lot of germs, being bacteria, viral, and parasites, and even chemicals, can cause inflammation of the meninges. So meningitis, the causes are bacteria, viral, parasites, including chemicals. What commonly causes meningitis outbreak is the meningococcus, which is the Neisseria meningitidis. And that is the type that we are most afraid of because it has potential to cause mass outbreaks. And that is what we all try to prevent and protect against. And the previous outbreaks that we experienced in the country, sometime back in 1984-85, sometime back in 1977, there were lots of cases and deaths within the 3 northern regions and even spread to most of the other regions within the country. These 3 regions, the northern, upper east, upper west, fall in a zone we call the meningitis zone, and the season starts in October and continues to somewhere February, March the ensuing year. So depending on the causative agent, if it is Neisseria meningitidis, then it's Neisseria meningitidis meningitis, and that is the one we commonly call the cerebrospinal meningitis, and that is what we are afraid most of. The other causative agents, being bacteria, include the Streptococcus pneumonia, which is the strep pneumonia, and that's the pneumococcal meningitis. And the problem and difficulty with that, though it doesn't cause mass outbreak, but then the death rate of the affected is so high, and it can be as high as about 60% initially, which later improves. So causes of meningitis are what are elaborated. Right,
quite serious, but we are told of this particular outbreak in the Bono region and in areas such as Tyne. Could there be any particular reason or Yeah, any particular reason why the disease outbreak is actually around that particular area?
Indeed, the germ, being the bacteria, strep pneumonia, it lives within the throat of most of human beings as a normal commensal. And during the dry season, when the dry season starts, and here our dry season starts with the Hamatan, the throat gets cracked, the upper airways get broken, the immunity at that area for defense against penetration of this germ into the body gets weakened, and the germ takes advantage and gets into the bloodstream, finally ending up in the meninges. So periodically it happens, but then how it exactly happens, the risks are what I've mentioned, being the dry season, overcrowding, and people with weakened immunity for one reason or the other. So it's unfortunate it happens, but then the important thing is how do we pick this quickly when it happens and deal with it?
Exactly.
So there are teams that are monitoring the various thresholds for each suspected case. You take samples, send it to the lab, and then make sure that you know what you are dealing with and address the causative agent, the cause adequately. This one, it was picked early, and I think initially when we had 12 cases with 6 deaths, unfortunately. But then immediately measures have been put in place. The region and districts are actively on the ground, certified public education, following contacts and giving them necessary medication, and making sure that it doesn't spread further and cause undue havoc and death.
So for residents of Tyne who might probably be watching us right now, what is that word to them? How are they supposed to live their lives such that they do not come into contact with this disease in the first place?
Well, I mentioned earlier, the germ may be living within the throat of some of these people. What we are doing, if it's not everybody who has the germ that will develop the meningitis, but then as soon as people start having the signs and symptoms, those that report early, survival is almost 100% at high. It's when we delay and get to the hospital at the late hour, which we start having problems.
And what are the signs what are the signs that should get you worried?
The signs and symptoms include fever, general weakness, headache, and neck pain and neck stiffness. So any of these symptoms and signs, when present, and we need to immediately report to any of the nearby health facilities. And I'm aware that these facilities are well trained to help solve the problem and help the person, those people affected.
Many thanks for your time on News Desk this morning. And that was Dr. Bedu Sarkodie, is the Director of Public Health at the Ghana Health Service, helping us understand what really that disease is and how we can prevent ourselves from getting into contact with it in the first place. You're watching News Desk here on Joy News. Time now for some business with Emmanuel Aboajiriafe.